Oftentimes, when we think of health equity, we think of it in terms of access. Does everyone have equitable access to medical treatments, vaccines, and care? But achieving health equity and reducing disparities in healthcare must start much earlier. For far too long, research has not included diverse populations and has failed to engage stakeholders from underrepresented racial groups, further perpetuating existing health inequities and adding to the widespread disparities that have become particularly apparent during the COVID-19 pandemic. While white Americans make up 67% of the U.S. population, they comprise 83% of trial participants. What's more, while Black African Americans and Hispanic Latinos make up 13.4% and 18.1% of the U.S. population, they make up only 5% and less than 1% of trial participants, respectively. This is categorically unacceptable. Race, ethnicity, age, sex, environment, and other social determinants of health, including socioeconomic status and health literacy, can all impact how different people respond to the same medicine or vaccine. This is why inclusivity, starting at the earliest phases of research, is so important. The more diverse we can make every stage of the research process, from ideation to implementation, the more we can learn about the safety and efficacy of a potential medicine or vaccine for people who have characteristics like those of the participants. We can strengthen the link between bench to bedside and bedside to bench relationships, which is also known as translational research. If we understand the mechanisms of disease, we can better understand disease pathways, develop better targets, and not only treat the disease, but hopefully even cure the disease. At Pfizer, we're working diligently to close the gap in health disparities in minority and underserved populations by applying medical, scientific, and translational expertise to do more precise and targeted disease management and achieve greater equity in research. This is why we are launching the Institute of Translational Equitable Medicine, or ITEM. Our vision for ITEM is to achieve health equity by preventing, treating, and identifying disease drivers that disproportionately impact underserved and minority populations nationally and globally across 3 key dimensions: research, development, and medical activities. Our goal is to use data to help us understand the drivers of health inequities and how our scientific discoveries can meet the needs of underrepresented and minority patients to begin closing those gaps. ITEM will strive to integrate equity across our end-to-end development pipeline by delivering on the following key objectives: directing our research to understand the root causes of healthcare disparities in diseases across our development portfolio, identifying new targets of diseases that are inclusive of underrepresented minorities for the benefit of all populations, amplifying precision medicine by including minorities and identifying root causes of disparities, working with colleagues across Pfizer to enhance key initiatives focused on patient centricity, health equity, and social determinants of health, engaging and partnering with the communities that are most impacted by inequity. At Pfizer, we believe every patient who is suffering from disease is having a personal pandemic, and every patient deserves a breakthrough.